Hello, this is a demonstration of SimTiming with the EdEHR, an educational electronic health record system. I started off with the scenario by going to ChatGPT and just asked it for a very simple case study where medication the dosage would change depending on some conditions. The system gave me back a very basic case study, and I've transcribed that into the EdEHR. And we're in the EdEHR now as a student, and we will check our instructions, and it says to administer medication as necessary. So I come to the medication and I look at the instructions or look at the information, and it says I need to be careful of systolic blood pressure. Let's go check our vitals. One thing the EdEHR tries to make it as easy as possible for the student to explore the rights of medication administration. So we bring forward that into a menu, and we can check that we have 189, it's the high blood pressure, it's over 90, 82 beats per minute. So let's return to our MAR, and we could proceed to do the barcode medication administration. Fair enough. But this is an issue demonstration of SimTiming. What we're actually looking at this screen this is the instructor's view in the role of a student. So we can jump back out, become our normal role as an instructor, and we can go and adjust the SimTiming. We're going to advance it to the later stage in the class or the simulation. And then let's turn ourselves back into a student. The students would immediately see the difference if they're in class. Let's go jump back in as a student. What does the student see? Once again, let's return to the vitals. And the time, by the way, is now 1600 in the day. It was 1200. And we notice that the blood pressure is 170 over 90, 60 beats per minute. So we can return to the MAR and read our instructions. Now, what I've actually done here is looked into it a little bit further, and I'm not a professional, but my understanding is you would not prescribe this medication if the person had lower blood beats per minute. If the blood pulse wasn't sufficient. And I leave that in there as a possibility for you folks who are more experts in this when you're creating case studies, that you're leaving this opportunity for the students to use their critical thinking, critical reasoning. Is this drug the right one for now? It is prescribed for 170 over 90 or 170. That's high pressure, but the pulse rate is slow. And so critical reasoning, perfect time for you to ask your students to come down and do a progress note, where they could add a handoff note or a progress note to describe their critical reasoning. As well, in the MAR, when we come in and do it, and I'll just jump in and bypass the barcode, we have this area called internal comments. And this is where we actually, comments would be professional comments, withheld medication because pulse rate was too low. You can ask your students to give their critical thinking, describe what they were thinking or doing in these internal comment fields. And we have those scattered throughout the EdEHR to help that communication between student and instructor, making this a pretty special application. Well, this is pretty cool. That's your sample of how easy it is for instructors to create case studies that are evolving and challenge the students to apply their critical reasoning. Yeah, I look forward to hearing from you and answering your questions. Send your questions to info@edehr.org.